Show, and we're really happy to have with us Dr. Adam Rubinstein. Is it Rubinstein or Rubinstein?
I say Steen, but either way is fine.
Okay. And he is a board certified plastic and reconstructive surgeon in Miami, Florida. Is that where your practice is actually located within the confines of the city limits, or is it another city
Yeah,
around
well,
that?
my office is in Aventura, which is the northernmost part of Miami, and it's one of the nicer neighborhoods, sort of like Beverly Hills is in Los Angeles, but same kind of thing.
Yep. So tell me a little bit about so about your about how you got involved in plastic surgery. So you're a young student, you're going through medical school, and you decide you're trying to figure out, well, what am I going to do now? I'm through medical school. You're in residency, and you're thinking, okay, now what's next? How did you get from there to into the plastic surgery realm?
Well, I'll tell you, there's two steps to that. One is when I decided I was going to be a doctor, and then the next was when I decided I was going to be a plastic surgeon. Now, the doctor, I kind of had an idea, and I wanted to do something in healthcare, maybe be a doctor. And so I decided to get some experience. Figured, well, let's go see what this is all about. And I used to, I'm now living in Miami and have been for a long time, but I was born and grew up in New York. And when I was in high school in New York, we used to come down, my family that is, used to come down to Florida. We had a condo in a little town called Hallandale. It's just a little bit north of where I am now. And the condo was close to a rehabilitation and convalescence center that I could walk to. And so I said, I'm going to go volunteer in that rehab and convalescence center. And so I did. And it was a place where mostly people would convalesce and a little bit of rehab going on, but it was mostly people with disabilities that would be there for assisted living and kind of live out their lives. And we called them residents, not patients then. And
Mm-hmm.
I'd been there for a while, and it's a two-story building. I was standing on the first floor just through the main entrance, which is where the office was. And suddenly this guy walks in with a stretcher and comes marching up to the main office where I was standing and said, "I'm here to pick up the body." And I said, "Oh, okay." I didn't know anyone had died, but he had a slip of paper, just handed it over, and had, sure enough, a room number on it. And I looked at the administrator and said, "Okay, okay, well, I'll take you upstairs." So I did, and we went up to the second floor on the elevator, wheeled the stretcher over to this room, and went in the room. And sure enough, there was one of the residents. They had usually two beds in a room, and only one was occupied, and there was the resident who'd passed away overnight. And my first experience, I must have been, I don't know, 15, 16 years old, something like that. First experience with mortality of that type, confronting an actual
Yep.
dead person in this bed. And it was profound. And I helped move the body over onto the stretcher, and then helped the guy downstairs, and off he went. And off I went, and I took the rest of the day off, went back to the condo, and kind of sat there staring out at the water and thinking about what I wanted to do with my life, because it was my first foray into the acknowledgement of mortality, right?
Mm-hmm.
And so I had to think about how I wanted to live the rest of my life and what I wanted to do for a living. And I thought, well, I like the idea of being a doctor and being able to make people's lives longer and better. It seemed like a good way to make a living. So that was sort of the idea of becoming a doctor. And then I got back, and I went to high school in this special high school in uptown Manhattan called Hunter, and it was a few blocks away from Mount Sinai. And
I was
so,
surprised that you actually were in this city because um, it doesn't sound like a heavy accent. I don't hear that accent.
yeah, it's
I
true.
don't.
Well, at a young age, I'm very in tune with sounds
Mm-hmm.
and speech and all that, and I made an effort at a young age not to have an accent of any kind. And I can put one on if you like. If it makes you feel more comfortable, it makes me more authentically New Yorker, then I can do that. But I made an effort not to do that
Yep.
because I didn't think it it was an attractive sound. I wanted to be more universal, and so yeah,
Hmm.
it's interesting you picked that up. But yeah, I did not. I made an effort not to have a particular accent. So, um,
Interesting.
and so
It
now,
worked because I don't hear it. So
well, good, well, good. That's the
so
idea.
continue on because I want to hear the rest of it. So you
Yeah,
went
well,
from
so the story of how I wanted to become a plastic surgeon started really at Mount Sinai. Um, I volunteered there, and again, I wanted to get some experience, and so I split time in a research lab and then in the emergency room. And it was really in the emergency room where I had that experience that said, okay, I think plastic surgery is for me. And in the emergency room, they split into a medical side and a surgical side. And the medical side is more treating things like high blood pressure and colds and people that come in with medical illnesses that don't require any surgical intervention. And then the surgery is for everything that requires a surgical intervention.
hmm
And it took me about 5 minutes to figure out that I wanted to be on that surgical side because it's just my
hmm
personality. Kind of get there, cut to the chase, no pun intended. Go ahead and do something directly, to make some intervention that moves the ball forward and help solve a problem. And that was more my personality. So I was driven. I was drawn to that side of the ER. And then when I was there, while I was doing my time and volunteering, one day, a young girl came in with her parents, uh, taking her into the emergency room frantically. She had gotten her fingertip caught in a closing door, and they brought in the little fingertip in a cup with some ice and some gauze, all harried and nervous. And they sat the parents down, relaxed, got them to calm down, took the kid into a treatment room and called the plastic surgery resident who was on call to come down and take a look. And resident comes down, and he looks at the tip of the finger and looks at the girl and calms her down, sits her down, does a little injection in the block, and then sews on that tip of the finger with itty bitty little stitches, perfectly placed one by one all the way around the tip of the finger. And I watched that and I said, that's the kind of surgeon that I want to be, that kind of attention to detail, that neat perfection of every stitch being just so. And
Yep.
it spoke to me that way. So that is what ultimately said, I think plastic surgery could be for me. And then, of course, got to medical school and got some more experience within plastic surgery. And I said, yeah, I think this is for me. And the last 25-ish years are history.
Wow. So 25 years you've been practicing as a plastic surgeon, and how
Well,
much of
I've
that?
been in, yeah, my practice, let's see, we're going to be going, I'm in my 23rd year right now. Yeah.
No, congratulations. That's a great accomplishment. So tell me about your practice. What do you specialize in one particular area? I find plastic surgeons will do a number of different things, but usually you have some sort of a specialty that you like to work in. How would you describe yourself?
Well, my practice, I think, is really it's focused almost entirely in cosmetic surgery, but it's of every part of the body, face, breast, body. There are practices that specialize, you're just doing faces, you're just doing noses, you're just doing breasts, but I actually enjoy the variety of what I do. And I might do a facelift one day, and then the next day do a complicated breast surgery, and then the day after that I might be doing body contouring for someone who lost over 100 pounds, and all of that variety is what I enjoy.
Okay, so tell me about. Let's talk for a minute about body contouring because that's really a big subject right now because a lot of men and women have lost these tons of weight on Ozempic or other. I mean, it used to be you had some sort of a gastric bypass or something like that, and that's when you had that. But now there's many people who are losing a lot of weight and they have all this excess skin all
Yeah.
over their body. I mean, what is it, a peniculectomy?
Peniculectomy. Uh-huh.
Peniculectomy, which is, that, well, you know what it is, but for the benefit of our viewers, it's when you have this hanging stomach a flap, and but then there's also the arms and really the legs, and I've seen some really pretty extreme situations. So how much of your practices kind of went that direction recently because of the new GLP type drugs?
Yeah, well, I mean, the GLP-1s certainly are making weight loss more common. I mean, everybody seems to be on them, and everyone's losing weight. In fact, we do offer them in my practice. We have a weight management program in the practice. But I don't know that it has really changed so much the bigger operations because people tend to lose 15, 20, 30 pounds on the GLP-1s, but the big weight loss still tends to happen with people having gastric sleeves or bypasses in the past or lap bands in the past. Mostly these days now we're seeing gastric sleeves and the surgical, bariatric surgery is really
Hmm.
responsible for a lot of the massive weight loss patients. It's a lot more efficient and just works well. But the drugs are definitely making a difference. And where we see that changing things is really more in the smaller procedures as people start getting just generally loose. When you lose 20 to 30 pounds, face may sag a little bit. You get a little bit of stuff hanging in the neck. Women's breasts will have a little bit of sag. Generally, the skin gets a little bit softer, a little bit more relaxed. So we're seeing skin tightening uh, becoming a lot more popular, different treatments, and we've got great technology there that we haven't had in many years past that makes a big difference and can really make some nice changes. Um, whether it's in the face, whether it's in the body, skin tightening has been a big deal. Volume addition, whether you're doing fat transfer or using artificial things to help augment volume, especially in the face as you lose weight, you get a little hollow, usually in the front of the cheeks,
Hmm.
sometimes around the temples, and adding a little bit of volume there can really rejuvenate things. So we're seeing more of the finer tweaks with the GLP-1s. But weight loss in general is still a very big trend, as you say, and we're seeing a lot of patients. My practice has always been associated with weight loss patients and doing all sorts of things, and it really affects the entire body. I mean, thigh lifts, arm lifts, tummy tucks, lower body lifts, which go all the way around the tummy, the hips, the back, and the upper butt. Uh, Breast surgery in women, chest surgery in men, and of course facelifts and redraping the loose hanging skin that we see not only with aging but with extreme weight loss as well. So it affects the entire body, and my practice has been associated with that and been working with those patients for pretty much the whole time. And I definitely have seen a growth in that over the years as more people choosing to have bariatric surgery, and now with the GLP-1s, like I said, the finer little tweaks that are becoming a lot more popular.
Hmm. Well, tell me one of the more interesting stories that you've had over the last couple of years with someone coming in for plastic surgery and having a surprising result. Maybe it surprised you or surprised them. Sometimes those personal stories really will, people can really relate to that.
Sure, of course. I'll tell you the story I share with a lot of my bariatrics. We're talking about weight loss and patients that come in for that. There's a story that I tell a lot of my um, my weight loss patients because changing the body is one thing, but you really have to have the psychology and feel have the confidence as your body changes to make a full transformation. And it's a process. It's very difficult. It's not something that happens overnight, and it doesn't even happen with the body surgery. Not so quickly sometimes. And this is a patient that I had early in my career, had lost over 100 pounds, a young woman,
Hmm.
early 20s, beautiful young woman, and had lost a bunch of weight and had a bunch of skin hanging. Her breasts were sagging. And we did breast lift and augmentation on her, and we did tummy tuck. And when we were done, she looked like she could model bikinis. It was beautiful breasts, firm, full. I mean, it suited her age, and her body was beautiful, nice, curvy figure, and a flat, smooth, tight tummy. It was a real transformation with all the skin and the sagging that she had dealt with after weight loss. And for a young woman, that's profound,
Hmm.
even perhaps more so than men or older women. But I looked at her, and it was one of my early experiences with bariatric patients. I said, it's a tremendous thing that you've been through, all the weight loss, and now the contouring surgery, and you're done, and you look amazing. How do you feel now that you're kind of at the end of the road? And she thought for a moment, and looked at me and smiled, and she said, I feel like a fat girl in a thin girl's body.
Hmm.
And that really stuck with me. I've never forgotten that. And I always think about that when I'm seeing weight loss patients, because the psychological baggage that comes along with this tremendous transformation should never be neglected or underestimated. So I
Right.
try to be very sensitive to that. And, a lot of patients feel that way. They might finally get to the body they've envisioned for themselves, or they may never have seen themselves have. I mean, a lot of these patients have been overweight and obese their entire life. And they finally get to that point where they've conquered that and they're past it. And that we do the body contouring, facial surgery, breast surgery, whatever it might be, and get them to where they can feel good about how they look and have a lot more confidence. But in the back of their mind, they still have that little voice chirping at them about where they had been. And it never, well, not to say never, it's very difficult for them to let go of that fully. So that's the story that always sticks with me.
So when you do you practice? Are you a sole practitioner, or do you have associates there with you as well?
Now it's just me. I'm the only surgeon in the practice.
Okay, then you have cosmeticians, or
Yeah, I've
I
got
don't know
two
what you call
estheticians.
them. Aesthetic, another difficult to pronounce word. Ast-
Estheticians, yeah.
Estheticians,
There you go.
and then they do various fillers and things like that.
Well, no, estheticians can't do that. I do have a physician associate, a physician assistant, used to be called, my
Okay. Yep.
PA, and she is fantastic. She does most of the injectables, the light and laser treatments, and the estheticians, they're doing more, they'll do some energy treatments, things that use ultrasound, microneedling treatments. They'll do facials and chemical peels. Some of the energy treatments that work on muscle. We've got treatments that will help build muscle and burn fat. They can do those. But it's the only in the state of Florida, only a PA or a nurse practitioner can do injectables and laser treatments.
Okay, that's good because a lot of places that's not true. So that's interesting to find out. So, what role does artistry play in your approach to plastic surgery?
I think it plays a tremendous role, as you might expect, but it's important. I teach residents and students. I have visitors that come from all over the world, fully trained plastic surgeons, people that are in their training, students aspiring to be a plastic surgeon, and I have residents who are training in plastic surgery that rotate with me on a regular basis. And we talk about this kind of thing. It's very important. We all have our own aesthetic ideal, our own sensibility of what someone would look best with. What is the ideal result or the ideal aesthetic for a patient. But I think it's important not to impose your aesthetic ideal upon your patients. I think it's important to have a sense of what you think looks good and have a sense of balance and proportion. But you should also appreciate the wide spectrum of aesthetics and potential results and desires. The most important thing is that we deliver for our patients what they're looking for, not what we think looks best. Because you may have a certain aesthetic ideal in mind, but it may be entirely different from what the patient is really expecting and desiring. So it's very important to have that conversation up front, to speak to the patient, get a sense for what they're looking for and what their goals are and what's important to them, and to try and deliver that, and to temper your own sensibilities through the filter of what's going to deliver what they're looking for. Because to do just what you want might really be off of what they want, and you'll have a very unhappy patient. Even though you might think it's a beautiful result, you'll have a very unhappy patient. So the aesthetic sensibilities need to be broad and flexible and not really focused and rigid and narrow, because we just deal with a variety of patients that have a variety of goals and wishes and desires, and you've got to be able to address that.
So
So
on that, a follow up on that is that if someone comes in and they bring in a picture of a celebrity and say, "Doc, I want to look like this," and how do you break it to them? That you have to deal with there's certain physics and or do you just try to do it as, I mean, how do you have that conversation? What's the best way to, I mean, you can say, okay, well, you can kind of look like that somewhat in this, I mean, how do you have that conversation?
No, we don't really. I don't ever tell a patient to aspire towards a certain famous person. I've been interviewed for newspapers and magazines that always talk about this. Who's the hot celebrity? What does everybody want to look like? And there are some. I mean, there have been a lot of typical ideal looks that people like to have. But I always am very careful not to advise a patient to do that or have that expectation, because the only way you can look like a particular celebrity is to have been born looking like that celebrity. What we can do is talk about proportion, right? We talk about features that you might like, and people will bring in a nose of someone that someone really likes. And that there'll be features on it. There's proportion with the face, and we can talk about those elements. Say, okay, well, what do you like about this? Because obviously I can't pop a feature off of a photo and stick it on a patient. You can't do that. And there are, as you mentioned, there's anatomic, physical limitations on what you can do with someone's tissue. You can only move things around so much. So what's really more important is proportionality and shape and how it relates to the overall view, the gestalt view of a face or a body with breasts or body contour. And it's a good vehicle to talk about a direction you might want to go in, but really careful not to give anyone the sense that that's our goal. You can't come in looking like Joe Citizen or Jane Citizen and end up looking like Brad Pitt or Angelina Jolie. That's not reasonable and not a realistic expectation.
So what would you tell a young surgeon who is coming in and trying to start their practice? What would you tell them, or would you advise somebody else to go into plastic surgery, or what would you tell them about the pitfalls and challenges in building a practice? So you're established. I mean, you have patients who come. I mean, you have to do marketing and everything, but you have patients. A lot of patients who just come to you. If you didn't do another thing, you'd have a bunch of patients come to you after 25 years in practice. But when you're a young person, it can sometimes be difficult to build a practice, like building any
Sure.
business.
Yeah.
So what would you tell a young person, young surgeon, in the medical field about either A, becoming a plastic surgeon, and B, starting from scratch, or how would you advise them to start if they had determined they want to go that direction?
Well, I mean, just choosing the direction. I encourage anyone to do whatever it is that they love. There's an old Chinese adage that people often cite, which is, if you love your job, you'll never work a day in your life. And I'm not working. I love what I do. And I come in and it's fun for me. I like the people I take care of. We develop relationships. I love the transformations we're able to facilitate for people and really enrich people's lives. And I get a lot of satisfaction in sharing that process with our patients. It's a great privilege, actually, to share that process with someone, to see them show up with significant insecurities and concerns. And sometimes it can be a real thing in terms of not being in a normal state. I'm going to digress a little bit and tell you how one of my mentors explained the difference between cosmetic surgery and reconstructive surgery. And it's very important to understand kind of how I view what I do and the respect that you have to give it. Reconstructive surgery is when you take someone who's sick in some way and you operate on them and make them better. Cosmetic surgery is you taking someone who's perfectly well and you're making them sick in the hopes of making them better. Because when we operate on people, we put them through a process and they've got to recover. We're making them sick, and then they've got to heal that and get better and hopefully be in a better place than they were when we started. And so it's more of a challenge. It's a bigger process to take someone who's well and put them through cosmetic surgery to try and improve something about them. And never lose sight of that and respect that. But it is also a great privilege to take them through that process. And frequently, a lot of what we do is really almost more reconstructive. We talk about weight loss patients. I mean, people with skin hanging all over their body is not a normal state. That is an abnormal state, but it's still viewed as cosmetic surgery. Really, it's reconstructive. You're trying to get them back to a normal appearance, because it's simply not normal to have skin hanging off of you like that. That's not a normal appearance for someone. But it's still viewed as cosmetic surgery. And so, those cases are almost more reconstructive. And it is a great privilege to bring someone through that and share those moments. I can tell you that whether it's a facelift, a rhinoplasty, a breast surgery where you're really fixing something that's complicated and not good for them to start, body surgery, body contouring when they've got tons of skin hanging all over the place, that moment that they see themselves for the first time after surgery, it is such a beautiful moment. It's surreal to them. It's the manifestation of what they've been dreaming about for a long time sometimes. And maybe they never thought they'd get there. And then you're there for that moment. You're a fly on the wall to witness the first time they take it all in. And it is such a beautiful moment. It's one of the things I love about what I do. So I think, at the end of the day, you have to have that passion and that love. If whatever you choose to go into, love it. And if plastic surgery is it, then by all means. A lot of practicing plastic surgeons will give you what I call the 20-mile talk. And that goes like this. There's someone that comes up to them and says, yeah, doc, I'm thinking about coming to practice in Miami. I want to be a plastic surgeon. What do you think? It's, oh, man. Yeah, I mean, being a plastic surgeon is great, but around here, it's really competitive. Where you would do well about 20 miles up the road. That's what you need to do. You need to go about 20 miles away from wherever I am, and you're going to do better there. It's all nonsense. Right? I think you got to choose what you want to do for a living based on what you love. You got to choose where you're going to do it based on where you want to live. And the rest will work itself out. Life is a one-way trip, and you better choose the things you love to do because you'd be miserable if you don't. And if plastic surgery is what you love, by all means, go into it. It's a great way to make a living, just as I have explained, expressing my passion about what I do. And I love living in Miami. There's plenty of room. We got a bazillion plastic surgeons down here. And I have no issue with others coming in and joining the community. There's plenty of patients out there. We all find our way. And if you just concentrate on doing good work and taking good care of people, then we'll all be fine. So I think you just follow your passion and whatever it is you want to do and wherever it is you want to do it.
How do you handle telling a patient no? Or the ethics, or I don't know whether it's ethics, but just the difficult situation of telling the patient, no, we're not going to do that. For whatever, there's 100 different reasons why you'd say no. Right. But how do you handle that? Because that's a tough situation.
It can be. I tell more people no than I say yes. Because people come in frequently with a romanticized idea about what a procedure is going to do for them or the result that they're going to be able to achieve. And I'm very honest and very open about what's possible and what's not possible. So it's actually easy for me to look at someone and just say, that's just not going to give you what you want. I don't recommend it. I would not do that. That's easy. It's not a difficult conversation to have. I think where things fall down is when you have a patient that may not be a great candidate for other reasons, but they're a good candidate for the surgery and even for what they would like to have. Someone comes in and they want a facelift and they're a good patient for a facelift, but for other reasons, they're just not a good patient. And that's a more difficult conversation to have. And it depends on what the reasoning is. Sometimes someone will be fresh in a divorce and they're about to hit the single scene and they want to spruce things up and they feel like they look a little older and they're not really into the idea of having surgery, or they're not choosing it because it really means something to them, but they're scared of being single. And they're also going through a really tumultuous time when you're going through divorce, maybe the most stressful event that can happen in a lifetime. And that's not a great time to choose to have any kind of procedure, even though they might be a good candidate. And so you have to, we all do, all plastic surgeons play part-time psychiatrist or psychologist and really assess someone's state of mind and where they are in their life right now. And I will not infrequently talk to a patient and say, hey, listen, I think you are a good candidate. I think this can help you, but I don't get the sense it's really personally important to you. at this moment, and I know you're going through a really stressful time right now. I would urge you to kind of go home and think about this. And, you're going through this divorce, and I think that may be motivating your choice to do this. I do think it can help you, but I want you to be totally committed to this choice, and it's a very personal choice you're making. Go home and think about this, and, we'll come back if you decide, yeah, I think this is what I want to do, and we can continue our conversation. But I can sense the anxiety and the stress level that you're under right now. And that's a bad time to make such a serious life decision. So why don't you let things settle down, really think about it, and let your mind settle about this. And if it's something you're really committed to and you feel like, yeah, I feel strongly about it, then let's have another conversation. So, for those kind of things, that's how I would handle it. And then there are the patients that you just don't get a good feeling about. Someone who sets up some red flags. Maybe, they just got their bright-eyed and bushy-tailed, and they're just too eager to have surgery. They don't really grasp what that means, what they're going to have to go through, and you don't think that they're mature enough or prepared emotionally to really go through it. Or maybe they just have a ridiculous idea of what it's going to do for them, and they're just, you're setting yourself up for patient disappointment and a whole lot of headache. And in those cases, I usually just put it on me, and I say, listen, I don't think I can give you the results that you would really like. I'm concerned that I won't be able to achieve what you're looking for. So I don't think we're a good fit. There's a lot of plastic surgeons. I think someone that might have more confidence or understand a little better what you're looking for would be a better fit for you.
So how do you handle the balance, the work-life balance, because as a plastic surgeon, you're multiple things. You're running a business, and you're actually delivering healthcare, and there's two completely different hats, and they're both time consuming. How do you manage that?
It's not so much the time consumption as the inability or the unpreparedness that we all start with when we're going into business. And plastic surgery is unique that way. Most doctors don't go into private practice in hanging a shingle, as we used to say, and opening their own business. Plastic surgeons do. A good percentage of, probably maybe more than half, will go into.
So you think plastic surgeons are, then that really makes you risk takers, entrepreneurs?
Well, for better or worse, I think you're a risk taker by default, and sometimes it's to our own detriment, because we don't get business education in. Most of us don't get business education in college. Most of us have not done an MBA, and you certainly don't get any real business education in medical school. There's plenty of other stuff you're still, you're learning. So it's kind of an MBA on the fly, by fire. You make a lot of mistakes, you learn, you try and educate yourself along the way, and you do the best you can. And that was my path. I did not do an MBA. I didn't take any business classes in undergrad. My undergraduate degree was in psychology, and I think that suits me well now, kind of having that understanding and sensibility of patients' trauma and stress and how to relate to people. But it didn't help me at all in business. And medical school didn't prepare me for business, and residency, well, depending upon where you do residency, and that's when you're really getting your exposure to the practice of medicine, the real practice. You're seeing the ins and outs, especially in plastic surgery. You're seeing the ins and outs of how other plastic surgeons are running their practice. And you learn, sometimes you learn what not to do. And you learn, good ways of doing things, and you start developing your own sense of systems. But what I think really moved the needle for me in my practice was reaching out and getting help. Getting really experienced and educated experts to come into my practice and work as a consultant and take a look at what we were doing, point out the inefficiencies, get our systems tuned to where things ran better, they were more profitable. Really take a look and see, you might think you're killing it with something, but you're barely breaking even. You might think you're losing money and you hate doing something, but it could be a real cash cow. And unless you look and track and understand what to look for, you'll never know. And for me, I couldn't do that on my own. I've actually had a couple of different consultants come through and take a look at our practice at different times of my practice. And actually, I'm at a point now where I'm probably going to have another person come in and take a look and really try and fine tune things and get things to settle. I think periodically it's good to have fresh eyes look at that. So, you know, I think it wasn't a matter of balance. It was a matter of recognition of I know what I don't know.
Right. So you bring somebody else in to fill in the blanks. So where are you in your career? Are you looking to go another 20 years, or unsure? You're still having fun, so you want to just continue on with the.
Yeah, I love what I do, like I said. So I mean, I when I get up in the morning, it's not drudgery. I'm not dreading coming to the office and seeing patients and seeing my staff. We have a great staff. We have fun. What we do is fun. We're in a fun business. We take care of people and we make them happy. And even when we aren't able to make them fully happy, we're still moving the ball forward for them. By far and large, we're in a really happy business. So, as long as I'm enjoying it, I'm going to keep on doing it. Now, I do many other things, and I do medical legal consulting. I do consulting for new industry. I'm kind of known throughout the world as innovations and tech guy, new techniques, new technology. I'm one of those guys that gets it early and assesses the new technology, uses it at a very early stage. And then I also teach a lot. I'll go around the world lecturing. I just got back from Cape Town a week or two ago, and next week I'll be leaving, or actually almost a week from Monday, I'm leaving for Bangkok, and I'll be there for a conference. I've been all over the world. I go probably half a dozen times a year around the world to lecture, not counting other things that happen in this country, in the United States, where I go around and lecture. And so, that keeps me interested with lots of irons in the fire. And I'm involved in the development of some new products, new technology, directly helping guide the design of new things. So I got a lot of things going on, and I'm loving what I'm doing. I think in the long run, I will probably try and get a younger associate that can, pick up the ball and keep running with it in these times when I am out of the office. I mean, that's kind of the downside to being a sole practitioner. When I'm gone for a few days, I'm not here. And the practice is not drawing the same kind of revenue as when I'm here working.
Right.
What I've learned, though,
and you have overhead.
Yes, I do.
A lot of people they look at. I mean, plastic surgery can be pretty lucrative, but on the flip side, there's a lot of things that are going on behind the scenes that cost a lot of money just to run the business.
Well, yeah, my business draws many millions of dollars a year, and it costs a good portion of that to run.
I understand.
Anesthesia costs are high for the surgical stuff that we do. Running an operating room is expensive. My staff, and I run pretty lean. I'm not one of these guys that has 50 people working under me. Still, my human resource cost, as in most businesses, is the largest for me.
Right.
And I take that responsibility seriously too. Just like I take taking care of my patients and their safety very seriously, I respect my responsibility to help the practice run and to maximize things and to have all of us be successful. So all of my staff they're part of my family, and I want to do the best for them. So it is a lot. It is a responsibility I take very seriously. And so when I'm out of the practice and we're not drawing revenue, I have to balance that with the opportunity cost of being there and being at a conference and lecturing and not being there. And I still love all of it, so I find a way to balance that. And you talk about the work balance, that for me is the challenge in trying to figure out how often I can be away and do these international conferences or even domestic conferences, spend time teaching and learning new things and interfacing with industry and hearing about some of the new stuff coming up the pike. And then, being here and just doing what I do, seeing patients and taking care of them and making a living that way.
So I always like to ask too about when I have somebody on a little bit of personal information.
Sure.
Just because I think it helps the audience to understand more than this person. This is what they do work-wise. So what can you tell me about yourself personally that you'd feel comfortable sharing?
I don't really have anything that's hidden. I'm not worried about hiding it.
No.
I'm married. I've been married for over 20 years. And we have two kids. I have a daughter who's about to graduate from college at Emory, and I have a son who's about to graduate high school. And my son is doing college applications now. My daughter is doing law school applications now. My wife is an attorney, so she's actually busier than I am. And
Oh,
so, we both work a lot, and we've just, you make time for the important things all through my kids' childhood. We've made time to be there for the school activities with my daughter, the dances, and special things that you do as a dad with a daughter. And my wife does the same thing. I'm there with my son. He's a baseball player, and I'm there at
yep.
all of his games. And I've taken him around. We've done a lot of traveling for baseball and recruitment in college, and so I've taken him around to various camps and college campuses and showcases and recruitment trips, and it's a lot. But in life, you make your priorities. And what I've learned, and what I've found, is that you do what you need to do, set your priorities, and life will it has a way of accommodating whatever it is you need to do. I used to worry that if I were not in the office, that the business would suffer and I'd pay for it in the long run. And I've learned that that's just not true. What really taught me that was COVID. I was really a slave to being at the office, working late and just grinding.
Mm-hmm.
And then when we couldn't, I mean, you had no choice but to close down.
Yep.
We were closed for 2 months, and we did okay. We survived, and we came back, and we were doing all right. And I was able to pay my employees the entire time. Um, we
Oh, that's good for you. That's
yeah,
fantastic.
yeah, and we
'Cause
were
that
lucky.
was a tough thing for a lot of people.
It
So
was
that's
very tough, and in the state of Florida, we were lucky. We were not shut down for an extended period of time. I'm not sure how much longer I could have gone, frankly, and still paid my employees. But we had a good cash position when everything shut down, and I was able to keep paying them. We weren't making any money, but we had enough
yeah.
cash on hand to help people survive. And then
Well,
we
my hat's
came.
off to you for that. I think that's really admirable. That's fantastic.
Yeah, well, thank you. I mean, I just think it was the right thing to do, and I was in a position where I could do it, and so I couldn't just abandon my staff.
Yep.
They had families too, and I was in a position to be able to do that, and I was very grateful for that. And it was lean. It was very tough to do. We had to come back and build back up, and thankfully, like I said, life has a way of allowing you to make those adjustments and to come through. And after seeing that with such a drastic thing as COVID, I just felt like, okay, if I can take that kind of time off nonstop and recover and be okay, then, taking 3 days to go to an international conference and teach and learn is going to be okay. And doing that on a regular basis a few times a year, that's going to be okay. And if I have to take time off to travel with my son to a school, or be there for a baseball tournament and take 2-3 days out of the office, well, that's going to be okay too. And if I have to go to a parent teacher conference and leave early, or whatever life asks me to do, I just have faith that I'll be able to do it. I don't worry the way I used to about the time away. It's kind of that old sage advice you always get at the end of life when you're
Mm-hmm.
laying in your deathbed. We say as doctors or as plastic surgeons, you're not going to think back and think, man, I wish I'd have done a few more cases.
It's a lesson that I need to teach myself at different times. So why don't we just end it at this point? I really enjoyed it, and hang with me for just a second. I'm going to push the stop button here, and hopefully everybody enjoyed this little bit of time with Dr. Rubinstein. Before we end, though, why don't you tell us your information about if somebody is in the Miami area, how they could get in touch with you to get some work done, or even just to talk to you about their situation.
Sure. Yeah. Well, you don't have to be in the Miami area. We have patients that come from all over the world and certainly all over the country. Matter of fact, before I did the show, I just finished seeing a patient that had flown here from another state. So we see that all the time. And I think if you're interested in seeing what I have to say and seeing if I can help you with whatever your goals are, you can reach us, of course, on the web It's www.dr-rubinstein. It's rubinstein.com. I'm all over social media, so you should check out my Instagram. It's at Dr. Rubinstein, Dr. Rubinstein. We've got another Instagram that is for a TV project that we're working on called Naked Beauty, and it's at Naked Beauty TV. There's a lot of fun stuff there. We take you behind the scenes and show you a lot of inside industry stuff. So if you're interested in this stuff, for example, how you make a breast implant, well, we'll take you to the factory and we show you. There's a lot of how it's made, and then a lot of inside patient stories too. And of course, you can always call the office, and we'd be happy to set an appointment for you, and I'll be happy to see you. It's 305-792-7575.
Okay, thanks again, Dr. Rubinstein.
Yes.
With an I, Rubinstein.